So the COMBI-d study was a study conducted in advanced or metastatic melanoma in patients who had the BRAF mutation, specifically the most common mutations V600E and V600K. The objective was to see whether the combination of a BRAF and a MEK inhibitor was better than a BRAF inhibitor alone. We know that BRAF inhibitors alone have improved survival compared with chemotherapy, and this is the next step beyond that. We know in preclinical studies that the combination improved things by delaying the emergence of resistance and decreased toxicity, and this is the final plank in all of that work after phase 1 and 2 studies, which was so COMBI-d was a large phase 3 study comparing the combination of a BRAF plus a MEK inhibitor, both tablets, versus BRAF inhibitor alone. The primary endpoint was the progression-free survival, and the key secondary endpoint was the overall survival. It met both its endpoints in that the combination of a BRAF and MEK inhibitor, dabrafenib and trametinib, statistically significantly improved the overall survival for patients who got the combination compared with patients who got single-agent dabrafenib. It also improved the progression-free survival. The overall survival benefit, the combination reduced the risk of death by 29%. The median overall survival for patients who were on the combination was 25.1 months, and the median for patients who were on the single-agent dabrafenib was 18.7 months. This was a hazard ratio of 0.71. So significantly much better on the combination than single agent. In terms of side effects and toxicity, there were many less what we call cutaneous squamous cell carcinomas and skin toxicities we associate with BRAF inhibitors alone. That was much reduced with the combination. However, there were more fevers with the combination, which are manageable. So that's the data. The summary statement on that is if you have the BRAF mutation and have metastatic melanoma and are going to be treated with the targeted therapy, it should be a combination of BRAF and MEK inhibitor, not single agent BRAF inhibitor. And that should be dabrafenib and trametinib with this evidence. So basically what that means for patients is that there is hope. Treatments are prolonging the survival of patients with melanoma. We don't know for how long some patients will survive on these drugs. We know that there is a tail of the curve for patients on targeted therapies, meaning there are some patients who have a very long survival benefit, and we don't know how big that tail is yet. We will know in years to come, but I think it's exciting for patients. Once there was no hope, now there's a lot of different tools, and we are really and truly making a huge dent in this disease. It's a chronic illness already, and I really do think that we are curing some people.